The coronavirus seems unstoppable. What should the world do now? The global march of COVID-19 is beginning to look unstoppable. In just the past week, a countrywide outbreak surfaced in Iran, spawning additional cases in Iraq, Oman, and Bahrain. Italy put 10 towns in the north on lockdown after the virus rapidly spread there. An Italian physician carried the virus to the Spanish island of Tenerife, a popular holiday spot for northern Europeans, and Austria and Croatia reported their first cases. Meanwhile, South Korea's outbreak kept growing explosively and Japan reported additional cases in the wake of the botched quarantine of a cruise ship. The virus may be spreading stealthily in many more places. A modeling group at Imperial College London has estimated that about 2/3 of the cases exported from China have yet to be detected. The World Health Organization (WHO) still avoided using the word pandemic to describe the burgeoning crisis today, instead talking about epidemics in different parts of the world. But many scientists say that regardless of what it's called, the window for containment is now almost certainly shut. It looks to me like this virus really has escaped from China and is being transmitted quite widely, says Christopher Dye, an epidemiologist at the University of Oxford. I'm now feeling much more pessimistic that it can be controlled. In the United States, disruption to everyday life might be severe. Nancy Messonnier, who leads the coronavirus response for the U.S. Centers for Disease Control and Prevention, warned on the 25th of February. We are asking the American public to work with us to prepare for the expectation that this is going to be bad. Dye and others say it's time to rethink the public health response. So far, efforts have focused on containment, slowing the spread of the virus within China, keeping it from being exported to other countries, and, when patients do cross borders, aggressively tracing anyone they were in contact with and quarantining those people for 2 weeks. But if the virus, named SARS-CoV-2, has gone global, travel restrictions may become less effective than measures to limit outbreaks and reduce their impact, wherever they are, for instance, by closing schools, preparing hospitals, or even imposing the kind of draconian quarantine imposed on huge cities in China. Border measures will not be as effective or even feasible, and the focus will be on community mitigation measures until a vaccine becomes available in sufficient quantities, says Luciana Borio, a former biodefense preparedness expert at the U.S. National Security Council who is now vice president at InQ Telephone, a not-for-profit venture capital firm. The fight now is to mitigate, keep the healthcare system working, and don't panic, adds Alessandro Vespignani, an infectious disease modeler at Northeastern University. This has a range of outcomes from the equivalent of a very bad flu season to something that is perhaps a little bit worse than that. Public health experts disagree, however, about how quickly the travel restrictions that have marked the first phase of the epidemic should be loosened. Early this week, the total number of cases stood at more than 80,000 with 2,705 deaths, with 97% of the total still in China. Some countries have gone so far as to ban all flights to and from China. The United States quarantines anyone who has been in hard-hit Hubei province and refuses entry to foreign nationals if they have been anywhere in China during the past 2 weeks. Several countries have also added restrictions against South Korea and Iran. The restrictions have worked to some degree, scientists say. If we had not put a travel restriction on, we would have had many more travel-related cases than we have, says Anthony Fauci, who heads the U.S. National Institute of Allergy and Infectious Diseases. But many epidemiologists have claimed that travel bans buy little extra time, and WHO doesn't endorse them. The received wisdom is that bans can backfire, for example, by hampering the flow of necessary medical supplies and eroding public trust. And as the list of affected countries grows, the bans will become harder to enforce and will make less sense. There is little point in spending huge amounts of resources to keep out the occasional infected person if you already have thousands in your own country. The restrictions also come at a steep price. China's economy has already taken an enormous hit from COVID-19, as has the airline industry. China also exports many products, from pharmaceuticals to cell phones, and manufacturing disruptions are causing massive supply chain problems. It would be very hard politically and probably not even prudent to relax travel restrictions tomorrow, says Harvard University epidemiologist Mark Lipsitch. But in a week, if the news continues at the pace that it's been the last few days, I think it will become clear that travel restrictions are not the major countermeasure anymore. Smaller-scale containment efforts will remain helpful, says WHO's Bruce Aylward, who led an international mission to China over the past 2 weeks. In a report from the mission that Aylward discussed but did not publicly release, the group concludes that the Chinese epidemic peaked between the 23rd of January and the 2nd of February and that the country's aggressive containment efforts in Hubei, where at least 50 million people have been on lockdown, gave other provinces time to prepare for the virus and ultimately prevent, probably hundreds of thousands, of cases. It's important that other countries think about this and think about whether they apply something, not necessarily full lockdowns everywhere, but that same rigorous approach. Yet China's domestic restrictions have come at a huge cost to individuals, says Lawrence Gustine, who specializes in global health policy at Georgetown University Law Center. He calls the policies astounding, unprecedented, and medieval, and says he is particularly concerned about the physical and mental well-being of people in Hubei who are housebound, under intensive surveillance, and facing shortages of health services. This would be unthinkable in probably any country in the world but China, he says. Italy's lockdowns are for relatively small towns, not major cities. China is slowly beginning to lift the restrictions in regions at lower risk, which could expose huge numbers of people to the infection, Dai says. If normal life is restored in China, then we could expect another resurgence, he adds. Still, delaying illness can have a big payoff, Lipsitch says. It will mean a lower burden on hospitals and a chance to better train vulnerable health care workers on how to protect themselves, more time for citizens to prepare, and more time to test potentially life-saving drugs and, in the longer term, vaccines. If I had a choice of getting COVID-19 today or getting it 6 months from now, I would definitely prefer to get it 6 months from now, Lipsitch says. Flattening the peak of an epidemic also means fewer people are infected overall, he says. Other countries could adopt only certain elements from China's strategy. An updated analysis co-authored by Dai and posted on the preprint server medRxiv concludes that suspending public transport, closing entertainment venues, and banning public gatherings were the most effective mitigation interventions in China. We don't have direct proof, of course, because we don't have a properly controlled experiment, Dai says. But those measures were probably working to push down the number of cases. One question is whether closing schools will help. We just don't know what role kids play in the epidemic, Lipsitch says. That's something that anybody who has 100 or more cases could start to study. Some countries may decide it's better not to impede the free flow of people too much, keep schools and businesses open, and forego the quarantining of cities. That's quite a big decision to make with regards to public health, Dai says, because essentially, it's saying, we're going to let this virus go. To prepare for what's coming, hospitals can stockpile respiratory equipment and add beds. More intensive use of the vaccines against influenza and pneumococcal infections could help reduce the burden of those respiratory diseases on the healthcare system and make it easier to identify COVID-19 cases, which produce similar symptoms. Governments can issue messages about the importance of hand-washing and staying home if you're ill. Whatever the rest of the world does, it's essential that it take action soon, Aylward says, and he hopes other countries will learn from China. The single biggest lesson is, speed is everything, he says. And you know what worries me most? Has the rest of the world learned the lesson of speed? Steps to help cope with coronavirus. For many of us, COVID-19 has disrupted our daily lives and made everyday activities challenging. These changes, coupled with general uncertainty about the pandemic, can create feelings of stress, fear and nervousness. These feelings are normal, and people typically bounce back after difficult times. Steps to help cope. Taking care of yourself and loved ones can help you cope and make your community stronger. Stay informed with accurate, reliable information through trusted resources like the Centers for Disease Control and Prevention. Understanding the risk to yourself and people you care about can make an outbreak less stressful. Limit exposure to media coverage, especially for children, and avoid social media accounts and news outlets that promote fear or rumors. Care for yourself and monitor the physical health needs of your loved ones. Take deep breaths, stretch or meditate. If you are religious or spiritual, follow practices at home that provide you with comfort and emotional strength. Try to eat healthy, well-balanced meals and drink plenty of water. Exercise regularly and get plenty of sleep. Unless you are sick or have tested positive for COVID-19, going outside to exercise and walk pets is okay. In public, keep at least 6 feet away from others and wearing a cloth face cover. Avoid alcohol and drugs. Make time to unwind. Pace yourself between stressful activities and do something fun after a hard task. Connect with others through video and phone calls, texts or social media. Talk with people you trust about your concerns and how you are feeling. Be patient with yourself and others. It's common to have any number of temporary stress reactions, such as fear, anger, frustration and anxiety. Hold an image in your mind of the best possible outcome. Make a list of your personal strengths and use these to help both yourself and others stay emotionally strong. Encourage children to express their feelings and thoughts. Reassure them about their safety. Use language that is normal and consistent with how you usually communicate. Be creative and think of fun activities that will occupy their time. Keep a schedule, set appropriate limits and maintain usual rules when possible. New psychological first aid, supporting yourself and others during COVID-19 course. In order to help people build resilience and lend support to others during these difficult times, Red Cross Training Services has developed a new psychological first aid, supporting yourself and others during COVID-19 course. The content is based on guidance from the American Red Cross Scientific Advisory Council, the Center for Disease Control and Prevention (CDC), and the American Academy of Pediatrics (AAP). The online course takes approximately 1 hour to complete and includes content on recognizing stress as well as caring for yourself while supporting your family and coworkers. EVERONE reacts differently. People's reactions appear in different ways, not only in the way someone feels, but in the way they think and what they think about, their sleeping habits, how they go about daily living and the way they interact and get along with others. People who may respond more strongly to the stress of a crisis include older people and people with chronic diseases at higher risk for severe illness, children and teens, people who are helping with the response to COVID-19, like doctors, other health care providers and first responders, people who have mental health conditions, including problems with substance use. When to seek help. Call your health care provider if stress gets in the way of your daily activities for several days in a row. Below are some signs that you or a loved one may need to reach out for help. Crying spells or bursts of anger. Difficulty eating. Difficulty sleeping. Losing interest in things. Increased physical symptoms such as headaches or stomachaches. Fatigue. Feeling guilty, helpless or hopeless. Avoiding family and friends. If you are feeling overwhelmed with emotions such as sadness, depression, anxiety or feel like you want to harm yourself or someone else, call 911 or the National Suicide Prevention Lifeline at 1-800-273-TALK 1-800-273-8255. Finally, how to protect yourself and others. Know how it spreads. There is currently no vaccine to prevent coronavirus disease 2019 COVID-19. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person. Between people who are in close contact with one another within about 6 feet. O. Through respiratory droplets produced when an infected person coughs, sneezes or talks. O. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. O. Some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms. Wash your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact. Avoid close contact with people who are sick, even inside your home. If possible, maintain 6 feet between the person who is sick and other household members. Put distance between yourself and other people outside of your home. O. Remember that some people without symptoms may be able to spread virus. O. Stay at least 6 feet, about 2 arms length, from other people. O. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Cover your mouth and nose with a cloth face cover when around others. You could spread COVID-19 to others even if you do not feel sick. Everyone should wear a cloth face cover when they have to go out in public, for example to the grocery store or to pick up other necessities. O. Cloth face coverings should not be placed on young children under age 2, anyone who has trouble breathing, or is unconscious, incapacitated or otherwise unable to remove the mask without assistance. The cloth face cover is meant to protect other people in case you are infected. Do not use a face mask meant for a healthcare worker. Continue to keep about 6 feet between yourself and others. The cloth face cover is not a substitute for social distancing. If you are around others and do not have on your cloth face covering, remember to always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow and do not spit. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Then, use a household disinfectant. Most common EPA-registered household disinfectants external icon will work. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. Especially important if you are running essential errands, going into the office or workplace, and in settings where it may be difficult to keep a physical distance of 6 feet. Take your temperature if symptoms develop. Don't take your temperature within 30 minutes of exercising or after taking medications that could lower your temperature, like acetaminophen. Follow CDC guidance if symptoms develop.